Time now for Inside Utah Politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We do begin this morning with Taryn Hyatt. She is with the American Foundation for Suicide Prevention, here to discuss how the legislature is addressing mental health during this session. Taryn, always glad to have you on the show. Thanks so much for being here.
Thank you.
If we could start with a picture of suicide in Utah. We know it's always been a big challenge for us here in our state, but we have made some progress in the last few years.
Oh, we absolutely have. You know, Utah's on track to have, year 4 of a decrease in suicide death rates, and we've moved, out of the top 10 once they release and finalize 2020 data. And nationwide, we've now seen 2 years in a row, including 2020, of a decrease in the national suicide death rate. So we are making progress, and we need to just, again, roll up our sleeves and keep going in this fight to save lives.
Yeah, one obviously too many, but this is something that you can celebrate, coming down. How did we get here? What happened?
It's been a collective effort from a lot of folks for a lot of years, really making sure that we're talking about suicide. This Live On campaign that was created through the legislature a few years back has elevated that conversation to make it okay to talk openly. Increasing help seeking, make sure that people know what resources are available. We saw an increase to calls to the lifeline. That was one of the good things, I think, during the pandemic, is even though people were struggling, they were reaching out. They were trying to get access to services and help. And again, we're supporting people who've had the experience of suicide loss. They're not left, to battle that loss by themselves.
This is something that impacts most of us, either directly or indirectly. Talk about the impact it can have on survivors, those who have loved ones. Who went through a suicide.
Yeah, that's one of the things that's most near and dear to my heart. We're coming up on year 20 since we lost our own dad to suicide, and just the landscape is so different, but back then it was so lonely. You didn't have people that came and supported you. And again, not because they didn't care, folks just didn't know what to say. And we know that when somebody loses a loved one to suicide, their risk increases, exponentially. And so we need to rally around people and talk, again, support them in that loss experience, provide them extra support and resources for that grief journey that they're going to experience.
On your shirt, we can't see it fully, but it says, "How are you really?"
Yes.
Talk about the significance of that.
We have been working so hard to just push having a real conversation. Most of us will say, "Hey, how are you?" And we say, "I'm fine." Well,
right.
How
and
are
you just
really?
move on, right?
Yeah, and when we're not, right, we're anything but. Right now we know we have a provider shortage, not just in Utah, but nationwide. The amount of us that need support and help to talk about what's going on it's just not there. And so we really need to be our brother's keeper. I say that all the time. We need to be willing to talk to one another, to have those real conversations, and not be afraid to say what's really going on. Just being able to talk with somebody about what you're experiencing emotionally and in your own mental health is important. That's how we break down the stigma and get people help.
Yeah. The Utah legislature has taken a lot of steps to address this in the last few years. Let's talk about what they are focusing on this time around. Representative Steve Ellison was on the show a couple months ago talking about some of the things he's working on. What do you like what you're seeing from him?
Yeah, Steve has been such a great champion for our cause for so many years and really led the way. As always, he's going to bring another big omnibus bill that will support a lot of different aspects of our behavioral health care. First, we're looking at providing community grants to increase collaborative care. And what that means is in a primary care practice in rural parts of our state, they'll be able to apply for funding to bring in mental health professionals and be able to provide that kind of care in a primary care doctor's office. We know, again, that there's limited access to resources, so by having that available is big. They're also working on, and I actually did see that it went through just this week, a Live On license plate. We've had license plate designations for other health issues. We're going to have one now for suicide prevention, so sign up and buy your plate. But Steve continues to elevate the conversation around increasing capacity. We have a workforce shortage, we know that. Right now we're looking at a dramatic shortage in folks at our state mental hospital, at the developmental center. Over 179 positions that could be filled today. And a lot of that comes down to pay, right? We pay these folks, our psych techs, $12 an hour. It takes a special person to be able to work in these facilities and with these people, some of our most vulnerable people in our state. And when they can make more at McDonald's, that just doesn't make sense.
No,
and so
not
there's
at all.
a big push for that, right,
Okay.
to increase funding. to pay them a living wage and a wage that is worth, you know, the effort that they're giving back to our community.
Yeah, another effort we've seen play out over the last couple of years, both at the national and state level, is a 3-digit hotline.
Yes.
The idea of being able to just dial that instead of a long 1-800 number that many people may not be able to remember, and that is the 988 bill. I believe it's being sponsored by Senator Thatcher.
Yeah, so that, remember, 988 is going live in July. In fact, it's available now on some cell phone services, T-Mobile and AT&T. But 988 will be the new number that you call for crisis. You no longer have to memorize that 10-digit number. And again, instead of getting a law enforcement response, you're going to get a mental health response. We've increased capacity for mobile crisis teams. Again, this is a trained mental health professional and a peer support who will come to you in plain clothes, no lights and sirens, at your home. You know, talk to you, de-escalate a situation in a healthy way, provide you support and resources. And then we're also working to increase capacity for what they call crisis receiving centers. So again, instead of people going to jail or psych wards where they're put on a 72-hour hold, there's a 23-hour receiving center where you can go, seek services, get support, find out what next steps you can take to work through whatever it is that you're dealing with. And so Thatcher's bill this year will again make sure that funding stays in place for 988, that we have people available to answer those crisis line calls, and again that we have a mental health response ready for when people are struggling.
Let's talk about Advocacy Day on the Hill. It's coming up on Tuesday. It's an important time for you and other advocates to get the message out. Talk to us about the significance of that day.
Yeah, you know, this will be our 5th annual State Capitol Day, and we invite our advocates from across the state to come and join us. You know, our advocates are people who, like myself, have been impacted by suicide. We've either lost somebody we love is struggling, or we ourselves have been there. And this is their chance to come to the Hill and meet with their representatives. You know, we tell our advocates all the time, you don't have to know these issues backwards and forwards, but come and share your story. Share how suicide has impacted your life and be a part of that solution to change the culture in our state. So we're excited. We have about 60 people signed up that are going to come and join us Tuesday morning. We'll start with breakfast in the Capitol boardroom and go over the different asks that we have planned. And then we're going to end our day with a rally in the Rotunda and have some really unique speakers who are going to share their stories that we'll get to hear from.
Yeah, let's talk about that a little bit. One of them is a colleague of mine here at Channel 4.
I know, I'm so excited. So Nisha DeGaring is going to come and share her family's experience. You know, we need people to be able to talk openly about what their experiences have been. And Nisha's going to share about her sister's experience with the mental health system. We know that our mental health care system has not always been suicide safe, meaning some people actually have an increased risk for suicide when they leave inpatient treatment. So we're excited that she's willing to share that. Specifically, again, with her experiences at the State Mental Hospital. We know we have work to do there to, again, increase not only our workforce, but, you know, make sure that the care that we're giving is, again, safe and effective for families.
And that rally will take place at what time?
4 o'clock, and we're inviting anyone who's been affected by suicide to come and join us. We'll have masks available to keep people safe. We'll distance and do all those things, but we want you to show up. Bring a photo of your loved one. We're going to have a memory table set up where people can display those, and again, share your loved one with us if you've lost somebody.
Okay, we have about 15 seconds left, but talk about the importance and the impact sharing stories has on our lawmakers.
Yeah, you know, our lawmakers need to hear from us. Remember, they work for us. And when we tell them how we've been affected and the things that maybe weren't in place when our loved one was struggling or things that they could have done better, it helps inform their decisions. And if they're not hearing from us, again, they're making decisions that aren't informed. So come, share your story. Let them hear how suicide has affected your life.
All right. I have covered this event on the Hill many times and appreciate you coming in and previewing for it this year. Thanks so much for being here.
Thank you.
All right, stay with us. There's still more to come on Inside Utah.